Hello viewers, this is me, your host Sunanda, and you're watching me on News Meter. In today's special occasion of World's Mental Health Day, we have Dr. Charan Teja Koganti with us, who is a neuropsychiatrist at KIMS Hospital, Hyderabad. In today's Doctor's Talk, we will be talking about how social media is impacting your mental health, negative and positive. Thank you for joining, sir. And my first question to you would be, how do you explain a good or a bad mental health?
Okay, so mental health is inclusive of our thoughts, feelings, emotions, and behaviors. How we are thinking, how we are feeling right now, or what is the outcome of our thought process? What is our behavior? What are the consequences to how we behave? Our emotions. What kind of emotion are you feeling right now? There are primary emotions, secondary emotions. Primary emotions, as we all know, it is happiness, anger, sadness, etc. Then there are secondary emotions like jealousy, lust, rage, and other things. Now, most of us feel all of this. It will be abnormal if you don't feel sad. But if you're feeling sad too often across almost all the situations of your life, that is not a positive mental health. That is obviously a negative mental health, and that requires an evaluation and probably even treatment by a qualified psychiatrist. So mental health is a combination of these four factors, right? Sometimes mental health can affect your physical health as well. You know, um, if, for example, if I'm feeling anxious, it might manifest as my heart rate is going high. I'm not able to breathe. I'm sweating. I'm feeling giddy. I feel like going and using washroom immediately. So mental health and physical health can go hand in hand together because your brain is in the same body as your liver is, right? So, and every organ communicates with each other, and your brain almost controls every other organ. For example, if I'm feeling thirsty right now, that's not because of my throat, that is from my brain. If I'm feeling hungry right now, that's not because of my stomach, it's from my brain. If I'm feeling sexual, that is from my brain. It's not from your reproductive organs. So, brain somehow controls your entire system. For example, if I'm feeling hungry all the time and I'm overeating and I'm gaining a lot of weight, now you could go and obviously get your sugar levels tested and cholesterol tested, but also see a psychiatrist to understand why you are constantly feeling hungry. Is there a secondary reason? So we evaluate your brain and we try to understand, you know, why this eating disorder is happening to you. So mental health is not just one thing; it's multiple things. Basically, anything that is coming from the brain.
And what do you feel that how is social media affecting our like mental health in a daily life, be it negative or positive? So what do you think about it?
See, I feel like social media is very, very helpful in two, three aspects of our life. One of the first things is um, definitely education, because we can use social media for, especially in pandemic. Without social media, without online schooling, I'm sure like we wouldn't have gone further.
We couldn't
So
have
it is
gone.
quite helpful. Yeah. So I mean, right now we are able to. You are, I think, in a different part of country, and I'm in a different part of country. We're able to do this because
Exactly.
of social media. So that way, to connect, to communicate, even for dating, right? To meet, it's not usual that you would meet like-minded person in your real life. Sometimes you might meet them through social media. So, there are many positive aspects of social media: education, information, communication, socialization, forming relationships, etc. Now, the problem is there is a thin line. If I am if I'm not preferring to meet my friends, but only forming friends online, and I'm not engaging socially in the society. Now that's a problem. So for everything there is a thin line. The moment you cross that, it becomes a disorder, right? For example, I love watching reels on Instagram, but I only love watching reels on Instagram. Now there is a big difference, right? So the thin line will change it. Now coming to the negative aspects, there are unfortunately more negative aspects than positive aspects. I wouldn't blame social media for it. It's us as people how we utilize, understand social media as. lot of people, that are youngsters, are going through body image issues. That's because of social media,
Yeah.
right? Everybody, understand there is always somebody better than us, and there is already always somebody who is not as good as us. It's a theory of relativity, right? If you say somebody is pretty, that is a relative topic. If somebody who is prettier standing by social norms, that person becomes less pretty. So when you compare, somebody is always better in some aspects, right? Social
Nice.
media gives us unrealistic standards of beauty, unrealistic standards of success. So on social media, everybody is happy, everybody is successful, everybody is wealthy, right? And everybody is pretty or good looking or fit. So, somebody who is not feeling like they are all of these and going and checking many accounts that are showing other side of the reality, so they understand, their brain don't understand what is reality, what is fiction anymore.
Yeah,
As
maybe
long
we
as
can
you have
see this
clarity.
when we see people using those filters and the body shaping apps to kind of control and their
Exactly.
appearance on social media and how they look. So, and also they
Exactly.
post happy pictures on Facebook or Instagram, but
Yes.
they are actually sad in their real life and lonely. So maybe,
Exactly.
yeah,
Exactly. So the comparison can lead to a lot of body image issues. It can lead to eating disorders. We do see a lot of youngsters these days starve themselves. I mean, back in the day when I was a kid, I was happily eating. My metabolism was high. I was burning it. I was playing sports. Now, see the people who are starving themselves or overeating, but they're not burning their calories because they're constantly addicted to the social media. Now they're constantly in their chairs, not moving, playing games. Childhood obesity has become so common these days. As doctors, we do see such early cardiac diseases, early thyroid issues for women, and menstrual irregularities. So many people have very early periods and not regular periods.
yeah.
Now, when a girl has a period early, that means she'll also stop her period early. Once you
Hmm.
stop your period, your bones become weak, your mood becomes cranky. There are many things that will happen. So it's a chain reaction. One lead to another one. It's not like social media will cause cardiac arrest, but social media will cause something that will cause something, and that will cause something that can cause cardiac arrest. So especially in children, your children's brain is very sensitive to growth or sensitive to radiation. If you're using phones, if you're using whatever computer, the radiation, especially from phones, does affect your brain neural activity. It may not show its immediate effect, but later it will show a massive effect. So that is one very important thing. And also, a lot of people, personality wise, also they're very introverted. When you see them on social media, they're very opinionated. They voice everything. They speak very well. They make reels, but in person, when you meet them, they don't know how to communicate to people anymore because they get socially awkward. There is no filter, right? They look a certain way and they feel a certain way. So that way, it's more negative effects than the positive effects, both physically and psychologically, to be
Yeah.
honest.
So, when do you say that social media has like caused a really bad effect on your mental health? So when is social media really like taking you towards that mental health position where you are very much vulnerable and sad?
It's a very I'm going to give you a very interesting comparison. How do you know if you're addicted to alcohol, right? It's the same way. First thing is you're craving for alcohol. I feel like drinking right now. So if you feel like, for example, I am here, I'm a doctor, I'm doing a Zoom conversation with you, a professional conversation. If I'm an alcoholic, I would be thinking about when do I finish this conversation and go and have a beer or whatever. Right? Same way, I'm having conversation with you, but I'm constantly checking my phone, seeing what are the updates, who messaged, who liked my picture, who's commented on my picture. So I'm craving for this. That is first sign of addiction. Now, second thing is tolerance. When I say tolerance, that is not English tolerance, it's medical tolerance. See, when you are drinking alcohol, initially you would drink about 30 ml, and slowly 30 ml doesn't give you high. You increase it to 90 ml. Within no time, it becomes one full bottle. Same way, the number of hours you're using. We all use social media. I use social media. I use, like, let's just say, an hour per day. But slowly, 1 hour is not giving me enough high, enough happiness. So I'm using 2 hours, I'm using 3 hours, using 4 hours. In this process, I'm skipping what I'm supposed to do. I'm not going to the hospital on time. Making my patients wait. I'm just giving my example, right? So people can understand. Or I'm always late to meetings because I'm losing my time. I'm not able to track my time because I'm excessively using social media. Now, craving is one important sign. Tolerance is another important sign. Now, third important thing is withdrawal effects. Just like when you stop alcohol, your hands might shiver, you might not be able to sleep, etc. Same way, if your parents snatch the phone and tell you you can't use phone from today, you won't feel normal or happy about it, right? You'll feel very sad, you'll feel restless, you'll feel anxious, you'll have panic attacks, you might not be able to sleep, you won't feel like eating, you won't feel like talking to anybody, you're feeling very gloomy, there's nothing for you to look forward anymore in life, nothing makes sense for you, right? All these can be withdrawal symptoms. Now, these are the most common signs of addiction. Despite this, you also have other things where you don't have pleasure in anything else but only social media. For example, if I tell you that yes, your friend is here, let's go make plans, they'll be like, "Ah, why is my friend here? You know, I'm just watching something. I'm watching a Netflix show." Now that is an important sign. Losing pleasure in anything else but finding pleasure only in social media. So that is an important sign. So all these are signs of screen addiction. Yeah.
So, sir, what can be done to overcome all these issues?
Yeah. The first thing is, I think screen addiction is a very big problem in youth, more than like somebody who is like me, who is middle aged, right? 36 years. I have patience. I have my full day work, so I may not get enough time. But for youth, um, you have to set better example for them, because a lot of youth, they learn by observation, right? A child is growing, they observe around. And imagine, I was from a different generation where I was growing and no one had phones. There was only one cordless or like a regular telephone that is only to communicate, that too with your family across the continent or country. But now a child is growing up watching everyone has this thing. It's almost like a part of human body. So they don't know that this is something very different. They feel like it's such a normal thing to be on phone constantly. So I think parents has to set better examples for children in terms of where they give time for the children and they explain them that they are on their phone because they are working on their phone. They have completed their education and right now they are working, and the whatever screen or computer is their bread and butter, right? And they have chosen a stream that requires them to be on screen. They have to keep them telling that, because parents are not sitting and enjoying on phone, they're working.
Yeah.
Kids usually, when I get kids from my consultations, they tell the parents that parents are telling me to stop, but they're constantly on their phones, right? So they're not able to understand why parents are on phone. And second thing is, some kids tell me that my parents never have time for me. No, what do I do? It's a nuclear family. Back in the day, we had three generation family, or their grandparents, or there was somebody living with us, right? Now it's a nuclear family. Both the parents are working, which is good, right? But not able to provide time for your child, right? That is also one thing that we have to change. And stop distracting your child by giving phone in their hands. It starts from very early. I see 3-year-old kids, they start crying and parents just give phone in their hands.
Yeah, while
And they think that
eating,
they're
for
too
them
young.
to get
Yes,
distracted and all. Yeah.
yes. They think they're too young to realize it, but that's not true.
Yeah.
Nobody is too young to realize it. Every neural pattern is formed much early in your life. Even a 1-year-old infant will know the effect of the phone on them, and they'll only crave for more as they're aging. And a lot of research has proven this already. So that we have to stop. And also, we have to have no screen areas in the house. For example, dining table. Firstly, who is eating on dining table anymore? Parents, kids, everybody is in front of TV, making their own plates and eating their own food. They're not communicating anymore. And while watching the TV, they're also checking their phones. So this has to change. The social structure of the family, the construct has to change, where you are having meals together, you're having communication, healthy communication about what has happened in the school, what has happened in their office. It's a two-way communication. Share with your kids how your day went like, what you are feeling right now. So those areas, bedroom, we all charge our phones next to our bed, which is not good. It's quite dangerous. They always tell, don't keep phone close to your head, your heart, and your private organs. They does a lot of damage. Lot of sexual issues, infertility issues, cardiac issues, neurological issues, neuropsychiatric issues, psychological issues. They all come from the phone as one of the risk factor. So those areas we have to avoid. So keep your phone away from your, this thing. You're not missing out anything. And because the FOMO is what people always hold their phones. That is one thing. Other than this, you have to tell your kids there is a certain, basically sit with them and form a timetable. Don't give them orders like you can only use phone 1 hour. Kids don't like it. When they're growing up, kids are very rebellious by nature. They don't like to take commands, at least kids these days. So sit with them and discuss with them and understand that how many hours they would like to use the phone, and come to a middle ground. For example, if your kid says 8 hours I want phone and you're saying half an hour, that's not going to work. So tell them a middle ground is 2.5 hours. So this is an agreed time, right?
Yeah.
An agreed time is what you need to see.
And
Yeah.
even if we like just not consider kids as a like for the usage of social media, our adults who are at home, like our elderlies, they are also very much involved in social media nowadays because they are learning it now and they are so much interested in that particular thing. So they keep sharing memes and all those things. They do all these things nowadays. So how can we like
No,
help them
but
as
Sunanda, but the thing is, elders also use social media because they're bored.
yeah,
Kids
they
are
are
in some
look
other
yeah,
country. They're bored. They have nothing to look forward to. So I think if we have, so for example, in USA, there are these communities, there are these meetings where they can go and volunteer.
yeah,
Even retired people can go and volunteer into pet care, or they can go take care of someone else's kids in a community who are working. They can go even learn salsa. Right, my aunt is 62 and she's learning salsa in USA,
wow,
right? In India, they feel like, oh, once you're married and you have kids, your life is over. Like
done.
that
Yeah,
attitude also has to change. If they have something to look forward to, they won't use phone.
yeah.
Yeah,
But does that also affects like their health or their mental health in a bad way? Does that impact?
for sure, for sure, for sure. It affects everybody. I mean, just think about watching 9 p.m. daily news and going to bed,
Hmm.
having processed the terrible things that are happening, across the country, across the world, and going to sleep. Would you have a comfortable sleep? You
No,
won't. Your brain is your brain is excited, anxious, nervous. Even if you're sleeping, you'll have nightmares. You will not go to the deep sleep. You'll only be superficially sleeping. You morning you wake up feeling more tired. So I tell everybody avoid 9 p.m. news. Watch it little early. Yes, you have to know what's happening around, of course. So watch it early. Maybe make it at 4 o'clock, right? So television channels also has to stop telecasting at 9 o'clock. I understand for them that's the time when everybody is in the house and everybody watches. I understand the logistics, but there is also, or maybe also share happy news, not just the negative sides.
exactly. Yeah, true.
15 minutes happy news, 15 minutes positive things that are happening around the world. Why not?
Exactly.
Yeah.
So that's it for now, sir. Thank you so much for joining us.